My name is Bethany Gentry. I'm the Oncology breast navigator. I've been doing this since about the end of 2016. Prior to that, I worked in the infusion center giving chemotherapy. I've been in oncology for about 20 years now. I chose oncology originally because I just had a baby and I wanted a better schedule. That was my whole reason in the beginning for taking that job, but it ended up I found my niche and I love oncology patients. I love being able to help them just in such a tough time, and the relationships that we get to have with our patients has really been meant a lot to me through the years. Everyone that's diagnosed here at King's Daughters, their name comes to me. So first I just try to make sure that they are told about their diagnosis, that they're referred to the right people, the right doctors. And then if they choose to have their care here at King's Daughters, I meet with them at their very first appointment, just try to facilitate things for them, make sure that everything happens as smoothly and as quickly as possible. I always tell my patients when I meet them that first time that I'm their go-to gal. So if they have questions or concerns about anything, they can always call me. I think it does mean a lot to patients because they're overwhelmed in the beginning. They get a lot of options thrown at them and a lot of information that some of them have never heard before in their life. These words about the specifics of their diagnosis, which are really important in decision making, but they don't understand. And so sometimes they just call me just to say, I know that the doctor told me all about this, but I can't remember everything. And they just need to kind of discuss it and line it all out again. So I do think that's important in that way. And also just knowing that there's somebody who's always kind of looking out for them and who isn't going to let something fall through the cracks. I follow them through the whole treatment. Always want to make sure that they know I'm going to be there, even beyond. So sometimes I've had patients who have finished their treatment and they're just in their follow-up and they'll call with a question about, if they really need to do this, or if they need to reschedule an appointment, they still know that I can do that for them. So yeah, I tell patients I'm with them from beginning till recovery, surveillance, and beyond. We started our breast cancer support group here at King's Daughters a little over a year ago. We were meeting once a month on the third Thursday of the month up on the 5th floor where our office is located at 5:30, and it was going great. Our attendance was building up. The ladies were really starting to get to know each other, starting to open up a little bit and share, which I love to see them starting to develop relationships and really getting something out of that relationship. And we had fun. We would eat and talk, and we'd have somebody come and do a little talk most months of something that was of interest to them. And it was going really, really good. Unfortunately, we had to stop meeting because of COVID this spring, but we're hoping to start that again just as soon as we're allowed to meet. Monthly self-breast exams, I try to get women to do those because it's important too. I've had a lot of patients through the years that found their breast cancer themselves. There's nothing I love more than being in those first appointments with the patient who is able to hear the words very treatable, curable breast cancer, earliest stage, because those women leave those appointments going, oh, I feel so much better. Because cancer's scary. When you hear that word, unfortunately, the majority of people just take it as a death sentence and just get so fearful. But when they hear that their breast cancer was caught as early as possible, it's like you can see a load being taken off their mind, their stress level goes down. So it means a lot. If women need a mammogram, they don't have to have a doctor's order for a screening mammogram. They can just call our women's center and make an appointment. And a lot of women don't know that. They'll say, well, I don't have a family doctor. You don't need one to get a mammogram. Just call and get it scheduled. So that is something that I think all women need to be aware of, because some women don't know that they can just call and get one.